We're live. Kathy?
Well, good afternoon, everyone, and I would like to welcome you and call to order our Middlesex County Council meeting for Tuesday, June 22nd. So today marks a very special occasion. It is Kathy Bunting's last meeting with Council before her retirement day at the end of the month. Kathy has been part of Middlesex County for just about 31 years. And she has relationships with people right across the county in our municipalities from Dorchester, Thorndale, all the way down to Glencoe. I might be so bold to say, though, that her most important relationships have been with the members of council over the years. She has been a tremendous support to councillors and ensures that those relationships are kept relevant with the county. There will be celebrations planned for Kathy's retirement when it is safe to do so in the future. But in the meantime, today, we celebrate you, Kathy, and all you have done for Middlesex County. In true fashion, we have a very full agenda to make sure that your last meeting with us will be memorable. Congratulations, Kathy. And I think Jessica just popped in with a little goodie bag, but congratulations, Kathy. I know that she's got some words that she's going to share at the end of the meeting, but we couldn't kick the meeting off without recognizing the importance of today. So congratulations, and let's get going. Okay, is there any disclosure of pecuniary interest? Seeing none. The minutes from June 8th, was there any business arising that anybody wanted to speak to? Then you've got the minutes from June 8th in front of you, and unless anything has to be amended, I would ask for a mover and a seconder to approve those as presented. Councillor Richards, and a seconder, Councillor Mayhew. All opposed? And that's carried. Thank you. No deputations today. Inquiries or notices of motion? Councillor Vanderheyden.
Thank you, through the warden. Hello, colleagues. Good to see you all. As you know, Southwestern Ontario is having a transportation task force. It's been put together, and we're doing all kinds of work in all the areas of transportation. I know that Councillor Warwick is very aware of this. We had a discussion about this the other day at one of her meetings. I'm one of the co-chairs for the active transportation piece. Now, this is going to be done within the next month. We're going to have some meetings to discuss active transportation in our communities. And I was just going to send an invite out to you all this way by saying, if there's anybody in your community or on your staff that you think would be wanting to be on that committee, just to help us move forward with information about your communities, about the area, so we have everything in place before we go to the debrief meeting when we all get together at the task force. So I'm just going to send out to you. You don't have to answer me right now, but if you could email me, if there's a name, if there's somebody in your council or on your staff that you think would be able to share their information from your community or from the area, I would be happy to take that information along and get us all connected. So thanks.
That's great. Thanks so much, Joanne. Any other inquiries? Councillor Warwick.
Yeah, thank you. And through the chair to Councillor Vanderheyden. One of the things that's been talked about in the conservation authorities quite a bit is with this, the province wanting to define mandatory and non-mandatory roles. Active transportation, in fact, of walking trails. We really want to make sure that the conservation authorities really are able to keep their trails open, but the money not being pushed down onto the municipalities to do that. So I think I'm going to send you a letter about that. Because that might be something that should be brought up to everybody's attention, that there is a danger of losing our trails that way.
Thank you for that comment. Any other inquiries? Okay, reports and into new business. We have one from MLPS, and Adam Bennett, Commander of Operations, is joining us. Neil is unable to join us today, so welcome, Adam, and I'll turn it over to you right now.
Thank you, Warden, and through you to I'd like to take this opportunity to introduce the Middlesex London Paramedic Service 2020 Annual Performance Report. Do you have the slideshow, Chris? We can go to the next slide. So we can see that over the course of 2020, Middlesex London Paramedic Service responded to 90,590 calls for service, and out of those came in contact with 64,896 patients. We can go to the next one. When we look at our performance for these calls for service, 2019 was a rather unique year in that we were fighting the COVID-19 pandemic, and we saw a lot of changes that came along with that, and our call volume also reflected what was going on in society in general. So we saw a 6.8% decrease in the total life-threatening calls that Middlesex London Paramedic Service responded to. This was consistent with what other services had seen across the province, in that at the onset of the pandemic, the call volume decreased rather dramatically, with 2020 starting at a high from 2019. We saw in 2019, we ended with a relatively high increase in call volume over the previous year. We saw that sharp decrease in 2020 at the start of the year when the pandemic first hit, and we saw some repeated patterns along with the decreases in call volume that coincided with the different waves of COVID and along with the provincial shutdowns. You can go to the next slide, Chris. When we look at the unit hour utilization over the course of 2020, it did decrease from the previous year of 2019, which would be a direct relation to the decrease in call demand that we had, and as well the hospitals taking preparations for the pandemic as well, decreasing the number of admitted patients they had and increasing the access and flow to patient beds that we had in the emerge department had a tremendous impact on offload delays. So there were relatively few, if any, offload delays throughout the course of 2020. When we look at the overall UHU, or unit hour utilization, we can see that when we break it apart from the City of London and the county, we still see that it's still relatively high in the City of London alone, in that it just hits outside of our target ranges. And when we look at the service combined together, we're just at that upper end of our target range. So we can move to the next slide. When we take a look at the City of London versus the County of Middlesex, when we break everything apart and look at calls that were serviced outside of the City of London, roughly 10% of those calls were serviced in the County of Middlesex, and we can see that there were also respective decreases to each of the communities within the county as well. Go to the next one, great. Our reaction time remained consistent with the previous year, and that would be 84 seconds. The reaction time is the amount of time from the crews being notified to the time that they're en route to a medical call. There's several factors that can affect reaction time. Specifically, offload delays tend to cause increased reaction times in that crews are being paged out of different locations and they need to be moving towards their ambulances. Can we go to the next slide? Here we can see that the offload delays. So this is what I had referred to earlier. Within 2020, we saw a dramatic decrease in the offload delays at LHSC. We saw a 32.9% decrease from 2019. This had a huge impact on our reaction times, our response times, our UHU. So all of this played a part into what we saw when we were looking at our unit hour utilization. As we move through 2020, we're starting to see those numbers are starting to return towards what they were pre-pandemic times. The dispatch versus return priority. When we look at how calls actually are moved out of or into the community, when the Central Ambulance Communication Center receives a call, 66.32% of them are coded as a priority 4, which is a lights and sirens emergency response. And out of those, only 11.6 of them are actually returned as a priority 4. We can go to the next one. And during the pandemic, we also saw that shortness of breath was the most prevalent call for 911. Go to the next. In 2020, we introduced an emergency support unit bus. So with the help of LTC, we were able to secure this bus and have it retrofitted to be a multi-purpose or multi-use asset. So far, it has been deployed to do mobile swabbing in the county of Middlesex early on in the pandemic, which brought a lot of resources to a population base that may not necessarily have been able to move it into the city to go to the mass immunizing or swabbing centers. Most recently, it's been deployed as incident command to major incidents such as the structure collapse on Teeple Terrace, and it's being deployed for mobile vaccinations right now. When we are talking about COVID-19, out of all of the calls that our paramedics did over the course of 2020, they came in contact with 13,692 patients that had failed the COVID-19 screening and were potentially positive for COVID-19. This speaks a lot to the professionalism of our medics that we have, in that they have to don the extra protection, they have to follow new protocols that go along with that, and to have to engage 13,692 times is a rather significant pull on those resources, and they did a tremendous job throughout the year for that. Over the course of 2020, despite the slight drop in call volume, we did manage to drive 1.8 million kilometers. So that equates to 46 trips around the earth. So we can really do see that how busy MLPS is. And through 2020, we wanted to continue with our community engagement. So this was of paramount importance as well, especially during the pandemic, bringing public awareness. We focused in previous years on public access to defibrillation and CPR. And this was another opportunity for us to bring information and intelligence to the community, especially with regards to COVID-19, and also helping to reassure that Middlesex London Paramedic Service paramedics were in the community. They were actively fighting the pandemic, and they were there to render care whenever they were called upon. And as you can see, our statistics are really quite high, in excess of 7 million engagements over the course of the year.
Okay, well, thanks very much for that, Adam. We do appreciate the update, and I think it does go without saying what an integral part you and your team have played during the past 17 months. Fighting COVID, looking after COVID patients, you're right there, frontline, no question. And certainly our region is well served by everybody out there. So thank you for that. Any questions or comments from council at this time on the annual report? Councillor Vanderheyden.
Thank you. Just a comment more than anything. Well, congratulations to all of the staff and everyone. I mean, everything COVID was just crazy, and you all as a staff were very professional. You flipped into every scenario that you needed to flip into, and I think that really shows in the report where the numbers go one way, numbers go the other way, and you all stuck to the plan, and you all moved forward together, and you're all safe, and that was huge, and you kept our residents safe and took care of the people that really needed help. So it just shows how professional you all are, and I commend you for the work that you've done over the last year, and keep up the good work.
Thank you for that, Councillor Vanderheyden. Any other comments or questions? Bill, I know that this is going to be forwarded to the city, and that you recently had an MOC meeting. I didn't know if there was any update that you could give us that would be in tandem with the report that we just received.
Sure. The report you just saw will go to Lynn Livingston, the city manager for the City of London, and then be distributed to all council members and staff. But I often say to you that the most regulated industry in our service level is Strathmere Lodge. Nursing homes are really regulated. It seems like from a governance perspective, we have the most governed group is Land Ambulance. Just to remind you, we have a MOC, a Management Oversight Committee, that was established by agreement with the City of London, and that is an administrative group that meets to talk about different issues related to land ambulance across the region. We have the Authority Board, that is the employer section of the land ambulance service. And of course, we have council for budget. So lots of different bodies to talk to. The Management Oversight Committee met yesterday, and we went over a whole bunch of things. Most of the focus is actually on financial with that group, so that because the city and the county are the primary funders other than the province, but we talked a lot about what we know is happening with provincial funding information. We also gave, because the agreement we have for funding from the city is made up of call volume, it's made up of assessment and call volume, weighted assessment. What else am I forgetting, Cindy? There's another one. But anyways, because of those things, where a call is located, we really go over what we know at this point in time. Unfortunately, we don't know a whole lot. We don't know about what's happening with the provincial funding. We know that they have assured us that we will know before AMO, that we hope we'll know before AMO. So we went over that. We talked about the impact on the budget from COVID. So we are in good shape there. And we talked about our budget timelines. Just so in the past, the warden will tell you there's been some confusion about how we budget compared to the way the city does it in a 4-year cycle. And so we went over that and made sure we're all on the same page there. And we talk about other items like new station updates and what we're doing from a management perspective, and our vaccination program, which I think the warden will ask me to talk about a little bit later. So MOC met yesterday. MOC will meet again. Management Oversight Committee will meet again in September, just before the city finalizes, sends their budget, their 1-year budget to City Council. So that'll be good timing for that. And we're planning an Authority Board meeting for July 13th or 14th. We're just getting close to that, Brian, Kathy, and Curtis. And of course, we'll be to council in November talking about budget, and any other time you want Adam or I or Neil to come and talk about land ambulance, we'll be there. So that's the overview of that.
Thanks for that. All right, if there aren't any more comments, then I would ask for a mover and a seconder to receive the report for information and direct the county clerk to forward a copy of this report to the City of London clerk for distribution to the city's council. Councillor Vanderheyden, and a seconder, Councillor DeVitt. All opposed? And that's carried. Thank you. Okay, moving on. Report from Cindy, Middlesex Supports Program for 2021. This is always a report I look forward to. Cindy?
Great, thanks. And through the warden. Since 2009, the county has been supporting a number of programs that support children, youth, and vulnerable families. The funding for these programs is in the 2021 county budget. COVID-19 impacted some of these programs in 2020, but the county has reached out to the core funder groups to confirm programs and funding requirements for 2021. Marymount and Family Services Thames Valley, since 2020, have continued to support families virtually during COVID-19. A couple of changes to the programs in 2021 include the Middlesex County Library Board will now be the agency that provides the Early Literacy in the Home project. The library will continue to work with Middlesex Children's Services Network on this project, and also early on. In 2020 and 2021, the Western University Students' Council Early Outreach Conference did not need funding. In June 2021, they did have a virtual conference. In the past, we have allocated $5,000. I would like to point out, though, that they have already reached out to the county for the 2022 conference. And I just want to note, in 2019, 50 students from the county did attend. As a result of COVID, some programs were not able to run in 2020, and the funding was not allocated. This amount was approximately $27,000. So at this time, I would like to recommend that the funding and bylaws be approved for the 6 funders, and that the funding that was not allocated for 2020 and 2021 for a total of $31,928 be allocated evenly to the 8 lower tiers to support children and youth in sports and/or recreation, which is really in line with this program. Thanks, and very happy to answer any questions.
Great, thanks so much, Cindy. Any questions or comments for Cindy on this report? I think it's great to see where these dollars get spread right across the community. Okay, if there aren't any questions, then the recommendation is in front of you. I won't read it because it's quite lengthy, but if I could get a mover and a seconder for that, please. Councillor Elliott and Councillor Mayhew. And all opposed? And that's carried. Okay, councillors' comments or other business. Okay, then moving on to bylaws. Kathy.
We have a few bylaws today. Bylaw 7115, a bylaw to enter into an agreement with Marymount Family Support and Crisis Care. Bylaw 7116, a bylaw to enter into an agreement with Family Services Thames Valley. Bylaw 7117, a bylaw to enter into an agreement with Southwest Middlesex. Bylaw 7118, a bylaw to enter into an agreement with Strathmere Caradoc. A bylaw to enter into an agreement with Middlesex County Library for the Middlesex Supports Program. A bylaw to enter into an agreement with the Children's Aid Society. A bylaw to appoint Marcia Evenich, Manager of Legislative Services Clerk for the County of Middlesex. And a bylaw 7122, a bylaw to confirm proceedings for the Council of the Corporation of the County of Middlesex for June 22nd.
Okay, great. Thanks, Kathy. If I can get a mover and a seconder for the first and second reading of the bylaws. Councillor Brennan and Councillor Warwick. All opposed? That's carried. And a mover and a seconder for the third and final reading, please. Councillor Smith and Councillor Elliott. All in favor? Or all opposed? All in favor, all opposed? And that's carried. Thank you. Okay, moving into Committee of the Whole. And our first report is a governance report. And I'm actually going to be the one that's going to walk us through that. So, Chris, if you could pull the slides up for me. That's great. Thank you very much. So I know, I guess the next slide where it says the agenda, Chris. I'm not going to hit every single point on this agenda because a lot of it covers the education session that we held back in the fall. Certainly, if anybody's got any questions or wants any review of any of that, happy to discuss that, but I think we'll keep moving right through. I think everybody's familiar with how representation at the time, right now, is decided for Middlesex County, how the weighted vote-in works, and our Elector rule. So, and the rules of the game for changing. So if, Chris, if you can go down to that slide. Certainly, we've had a lot of questions over the last few years about governance and how it should look for the county. And if we want to make any changes to our governance structure, they have to be made before the electoral period starts, which of course is the beginning of 2022. And then depending on what change, if any, we were to invoke, there would be a process that we would have to follow, and we might require a triple majority to obtain that change. And I think it's important to note that any change to our governance structure does require a mandatory representation from the Village of Newberry on council. Okay, next slide, Chris. So it's no secret that county council, the size of county council has declined. In 2022, we will have 10 members if the population stands as it is. North Middlesex will lose the position, the deputy mayor position that sits on council currently. And then of course, Southwest Middlesex lost that position in the 2018 election. So in thinking about the reduction of council size, I think that we've all had some fruitful discussions as to, is there an appreciable difference moving from 12 to 11? I don't think that we noticed a big change in how our discussions and governance happened over the last, I guess we're into 2.5, 3 years now. And will there be an appreciable difference going down to 10? And we do still have representation from all municipalities, of course, with the exception of Newberry. Next slide, Chris. Certainly back long before I was on council, when before the change in structure, when county council went to moving as a committee of a whole, there were a number of committees that county council administered. And of course, the workload was spread amongst our councillors. That has really changed over the years, especially with moving into the committee of the whole. There have been a number of declining expectation of sitting on external boards. And as I mentioned, the committee of the whole has really changed the way the workload is distributed amongst councillors. So the options in front of us, next slide, Chris, of course, are staying as the status quo, just keeping things the way they are. To eliminate the minimum elector rule, right now, just for anybody watching, the minimal electric rule is to have two, I think it's 1,500 voters for representation, and then to have 2 seats at county council, the number is 5,000 voters. We could change that to a lower number, of course, and we could move the population numbers, or we could look at a hybrid governance model. Next slide, Chris. So changing it to eliminate the minimum elector rule is a complicated option. It does invoke the triple majority rule. It does address the Newberry challenge, and it establishes a set number of representatives. So rather than worrying about the elector, the number sitting around the horseshoe would be determined. Next slide. Changing the minimum elector rule is to changing how many, what that number is on the voters list. It's a little bit more complicated. It too invokes the triple majority rule. It also addresses the Newberry challenge, but where does that line get drawn? And how is that line determined? And then do we set ourselves up, does it become a moving target over the years? So next slide. I think the question when it comes to population is that there has been concern that the voting list and the electors is inaccurate, and it really doesn't catch it. It's always playing a game of catch up, and there still needs to be a line made. So that brings through, you know, complications and concerns in its own right. Next slide. Moving into a hybrid governance model. This model was first proposed in 2001, And the County of Wellington has adopted this model. It certainly does eliminate the disenfranchisement argument that communities might have. It addresses the Newberry challenge, and it would maintain the council side, and it provides for a direct election for a few members of county council. And I know that that has been discussed over the years, and I think that it would be safe to say that there's not a real appetite at this time for that sort of governance model. Next slide, Chris. So status quo, of course, that's our current position. And it is really the simplest, and economically, it's the most efficient way of determining the who sits around the horseshoe. It doesn't address concerns that council may be trying to solve, but I think what came out of our council education discussion back in the fall was trying to pinpoint exactly what it was we were trying to solve. So next slide. So certainly, I've given this a lot of thought, and I've had discussions with a number of you over the last few months about moving forward. And it would be safe to say, and I've shared this with a number of you, that I think my outlook on what should be done has changed as I've had discussions, as we've gone through the education session, and as I've looked and watched how we have been able to govern. I think I will be honest to say that the direct election process actually has become more attractive to me as I've learned more about it, as I've reached out to the County of Wellington to see how that works. But as I said a few minutes ago, I know that there's not an appetite for that at this time, but I don't think that it's something that should be completely shelved. And anytime County Council of the day looks at the way it governs, I do believe that partial direct election solution should be part of that discussion. Moving on to the next slide, Chris. So, you know, the concern is the sliding size of council and how it has changed dramatically, you know, with the last election and then this election. But I believe certainly there's some exciting projects happening in North Middlesex that I believe that the population will correct itself in the years to come. And it would be interesting to see at the 2022 election what those numbers look like for, you know, then the 2026 election. There's a lot of excitement with growth across the county. And as I say, I think that, you know, in the years to come, that those positions will come back. You've certainly seen some interest in some developments as well in Southwest Middlesex. You know, the concern with a voters list also being inaccurate is MPAC at the right now, of course, has control over our voters list. That is changing to Elections Ontario for the next election. Doesn't solve our issue for this, but they do come back to the municipalities with a draft voters list prior to it being finalized. And there really would be nothing stopping a municipality if they really had concerns with a voters list to hiring a contract position to do their own enumeration and then giving it and submitting that as the voters list to MPAC for the 2022 election. And that might solve the numbers issues for the next election as well, because I know that's a concern with some of our communities. Next slide. So with all of that, after all of this, I do think that maintaining the status quo in terms of our governance for our upcoming electoral period is the way to go. I'm actually quite surprised that that's actually how I think, because that's not how I thought I was going to think. But I guess that's why you go through the process, and you have the education, you have the discussions, and you weigh the options. And this is what I'm recommending to council. Certainly, I'm anxious to hear the discussion that ensues after this, because I know that there's a lot. We did have a fruitful discussion back in the fall, and anxious to hear comments and hear your thoughts on moving forward. And so with that, I will open it up for discussion. Any comments? Councillor Mayhew.
Madam Warden, thank you very much for the presentation. It was very interesting. Southwest Middlesex obviously has a closer connection to Newbury than my respected colleagues. Newbury does have a very small population, but there is a significant large commercial enterprises, 3 extremely large commercial enterprises within that small hamlet. Southwest Middlesex shares water agreements with Newbury. Our fire departments work together. Very often they're users of our recreational facilities, a part of our market. And Newbury has 2 very heavily traveled county roads through it, Haggerty Road and County Road 14. And what I find with Newbury, and I kind of say this with some embarrassment, that Newbury borders Chatham-Kent. And many residents have a more familiar relationship with Chatham-Kent than they do with Middlesex County. Sometimes they feel like the forgotten child, so to speak. And I think very often we may lose sight of that they share water agreements with Chatham-Kent as well, and among many other aspects of municipal sharing. So they find themselves in a position of taxation without representation. And, you know, a recent economic development brochure that came out listed the various municipalities within Middlesex County and how we all strive to foster an economic stimulus. And Newbury, of course, is mentioned in that. And when we, in our marketing materials, when we say that Newbury are part of our family, we say it, but I really significantly think that we have to show it. And I have mentioned it in all respect to my colleagues that Newbury, I would very much like to see Newbury back at the table, that they are part of the Middlesex family and not part of the Chatham-Kent family. Thank you, Madam Warden, very much.
Okay, thank you, Councillor Mayhew. Any other comments or questions on that report? Councillor Vanderheyden.
I was just waiting for if anybody else wanted to speak before I did. I appreciate all the comments and I appreciate the report. I think it's something we need to go through every 2 years or so in order to make sure that we are in the right spot. And I believe that we are in the right spot. I think the number of electors versus population, I mean, that changes all the time, both numbers. And at least you can kind of record the number of electors every few years as opposed to how many times we do a census. So that's one of those things that 6 of one, half dozen of the other. So, you know, it's the number we use. Either way, they're going to be lagging no matter which one we use. So that one is off the table for me. You all know how I feel about direct election. At this point, I don't think it's something that we require. Everyone that's on county council is already elected through their public and they represent Middlesex County. And I think that's a positive because you know what's going on in the municipality that you serve as well as the county. And I think that makes you stronger. I'm not sure that if I was, I'm not going to use me as an example. I'm not sure that just having someone that is not familiar with the rest of the municipalities and the work gets done at the lower level would be as effective. I'm not saying that the other communities that do this aren't, but I'm just saying I'm still not convinced that that's the case. Newbury is an awesome community, and I really believe that they are part of Middlesex County. They've made the decision not to amalgamate with anyone, and that's where all this stemmed from. So it's historical. It's not that we're trying to make them feel less of a community, because they certainly aren't. And I know that any border community, they shift over to whoever's on the other side of the border. That's not unusual. I know we have a lot of people that work here from Watford and shop here from Watford and go to the hospital here, and and that's quite a ways away. That's in another county. So I get how that works. So that's not convincing me either. What else did I write down? We are not as busy, to the warden's point, as we were before, and I think we can handle the workload, and if we can't, then we have to figure that out. But right now, I don't see, even through all of COVID, everybody's done their homework, everybody's continued to move forward. The Women's Caucus has been doing a lot of work on top of what we've been tasked to do. So I think we're moving in the right direction. So I am totally comfortable right now with the status quo moving forward, with the fact that we will revisit these numbers over and over and make sure that anyone that needs to be at the table and is under the responsibility of the 5,000 people is. And those are just some of my comments, not even a question, just comments.
Thank you for that, Councillor Vanderheyden. Any other comments? Councillor DeVete.
Again, not a question really so much as a comment. This is my first full term on council at county as the mayor. And from what I've seen is that the system works well and has been for quite some time in terms of being an effective way of making sure that there's representation from across our whole area that we serve, the county. The one thing that hasn't been mentioned, and I think this council shows that as municipal councils change with respect to age, gender, and diversity variables, this is also reflected now at county council. And I think there have been changes coming over time. So I think this is a benefit of having people who are elected by their residents representing the constituent municipalities at the county horseshoe. Of course, that can change over time. If we go to some other system of picking other people, the part in terms of direct versus indirect elections, I think the cost differential in terms of an indirect, it's an option, but I think it's a fairly expensive option. And I kind of worry about the diversity around the horseshoe if that was something that was going to be an option going forward, not just in terms of age, but who has an opportunity to do that kind of a campaign and then contribute the time if they're not involved at the municipal level as well. Is there an advantage to maybe some of the bigger municipalities with 2 representatives? Perhaps, but I think we've seen already from our experience with those who have only 1 voice at the table that really, I don't see that we tend to take an integrative look at our community of Middlesex County when we make decisions. And I think we're good at listening to hear what others are saying, because there are differences across the board. But when I look at all of the things that we vote on, I don't really feel that we're tending to overwhelm any certain part of our area. So I think perhaps in the future, I mean, the lagging thing is always going to go on forward, and some of those variables we can't really control very well. In hindsight or retroactively we can, but I think right now I would agree with your comments, Warden. Our option at present, I think, is probably a good way to continue. And if I do agree that we need to keep looking at it and monitoring and thinking about what options work well as we see other models evolve across the province, perhaps. I don't know, what if we're made to do another amalgamation or something? Certainly, then we need to look at how will things look down the road. So I would agree with your recommendation and suggest that we move forward with the status quo. Thank you.
Thank you for that. Any other questions or comments from my colleagues? Councillor Warwick.
Thank you. Warden, I guess I would just like to throw it out there. I don't know how everybody else felt about the impact list in the last election. I know our clerk was tearing her hair out because they were incomplete, and it took a lot of work to get through and to get the correct, information as far as voting. Is that something that I'm just throwing it out there to find out what everybody else feels about getting an independent person in before the next election to verify those results? Is that the way that we should be going? Because, as I said, it was a big experiment on our part and took a lot of work on our staff to get the correct information.
Okay, thanks, Allison. I don't know if anybody's got any comments. I think everybody agrees. I'll push to you in a sec, Bill. I think everybody agrees there was a lot of work that was required on the voters list. And I know in our municipality, our elections officer she's got a great connection with the community, so she was able to do that. But as our municipality grows, those connections she's gonna are going to be lost, and so I can't even imagine for a larger municipality how to keep on top of it. So to the point, if there is concerns about a voters list being clear, then maybe that is an option. Bill, what were you going to say?
Oh, I was going to add in that I did invite MPAC to the next meeting to talk about this very subject. And also it's a point that the warden and I are going to raise, hopefully, at the meeting on July 2nd with our local MPPs as well, because it's an efficiency argument as well. If we are going, it's not only a democracy issue, it's an efficiency argument. If we're spending time locally, we're not actually saving money by cheaping out on it in the first place. We're actually losing money by cheaping out on it in the first place. So those are two sources that we're going to be bringing into this conversation because it needs to be brought up again. And so I think Allison's question is a good one. It's just for a different group to ask that question, and we'll get you there probably at the July 13th meeting if everything goes according to plan.
Do you have any follow-up, Allison? Nope, good. Any other comments, questions from anyone? Councillor Robb.
Thank you. I just wanted to hear from other councillors before I said anything. And I have to agree with Councillor Vanderheyden that I'm not at this time in agreement with direct election for Middlesex County. I think what we have works very well. I'm not hearing a lot of support for changing. And I've talked to some other councillors who haven't spoke yet, and they seem to go towards the status quo as well. So one question I have, so a councillor is automatically dropped if it goes below 5,000. If it goes above 5,000, is that representative then automatically brought back in, or do you have to apply to bring a person back in, or what's the process there?
Bill can probably speak to that process.
Yeah, it's a lagging indicator, so it's at the next election. Well, Kathy, you might want to do this. It's your last meeting. You can go for it if you want. What am I doing?
Yes, that is correct. So it lags behind. So if you go over the 5,000 threshold at the next election, which would be 4 years later, you would have your second person back on. So there's a 4-year lag.
Okay, so I guess the question is, though, for the sake of discussion, since I've thrown it out there and Councillor Warwick mentioned it. So an enumerator goes out and on December 31st, there's 5,000 voters for the 20, and that's the voters list for the 2022 election. That community would get 2 representatives?
No. So the numbers are calculated after the voters have voted. The clerk would do a clerk certificate as to the number of electors, and that is what is used for your weighted voting and to be able to put someone on, an extra person on county council.
But we get that. So we get that at the first meeting, the inaugural meeting, we get, you may not have seen it just because in COVID times, but Kathy and I collect these at the inaugural meeting just so that we can verify everybody's supposed to be there, and that's the way it works. So the trick would be what you suggested, is to make sure you don't fall below that in the first place, because there is a lagging factor there, as Kathy talked about. So that's why I asked MPAC to come and talk about this at the next meeting, in case some municipalities want to take advantage of that.
Follow up, Brian.
I just want to make comment to it that it's certainly very tough to speak on this because it is involving North Middlesex, and we're the primary losing a representative here. I did have the same thoughts when in the last term as well, when Southwest lost there. So this isn't something new just because it's North Middlesex to me, that I do think there is some kind of change that could go in there to I mean, 100 people, it seems quite, it's pretty marginal, but anyways, but I'll go with the wishes of County Council and how they feel about this. And I do believe the format that we have and the people that we have representative from lower tiers, I agree with that. I'm not in favor of direct election at this time, at least. That's it.
Thank you, Councillor Robb. I think I saw Councillor Smith's hand up.
Through the warden to either Kathy Bunting or Bill, just further clarification of that 5,000 and the second seat. I'm a little confused. So when is that number decided? So because the way that it was just explained, it sounded like after the election happens, then you make sure that there are 5,000 electors to have that second seat. So then there can be the deputy mayor and the mayor sitting at county council. But in this case, North Middlesex is already under 5,000 right now. So I'm just confused. What is that date for having over 5,000 electors?
So that date is just before the inaugural. I receive a clerk certificate as to the number of electors and the person elected that they've taken their oath of office. So once we have those, that is the deciding factor if they would get another person at the next election. So it's 4 years off.
Now, just to be clear though, Kathy, let's make sure we're telling them where that rule is, because that's in our procedural bylaw, that rule. So that's not a provincial rule. I don't want you to think that that's not something you control, because there are things around elections that you don't control, that like nomination day, etc. But in this particular case, you could actually change the date for when that's effective. There hasn't really, so it's not set in stone, Curtis. In fact, our procedural bylaw is going to change quite a bit before the next election. And it's something you could review at that time about when that certificate is required for this particular purpose. You know, we do need a clerk certificate for other purposes, but for this particular purpose, it could be later in the term. It would have to be before nomination day, because the trick about nomination day is people have to know what office they're running for and people have to know what they're voting for. So nomination day is, you know, that first day of the year. So it would have to be before then, but it is still possible for you to amend that. I would say you'd have lots of time to do that.
Okay, so I fully understand, and hopefully everybody else listening. So in 2016 or 2014, whenever the election was before, North Middlesex had just over 5,000. So because of that, of those electors that were issued then in 2018, they were able to have the mayor and deputy mayor, even though possibly by that date there was under 5,000 electors, which then was certified after the election and on inauguration day, which then means that in 2022 they only have one seat. Because
that's exactly right. And the other term that's important to clarify, since we can't do a glossary of terms in this type of report, but electors is an important term as well. Some people misinterpret electors as people that voted in the election. I know most people on this screen know that an elector is eligible, a person that's eligible to vote. So we have some municipalities that their population, you know, Joanne rightfully said, population's an interesting number as well, but we have some municipalities that changes a lot, but we have some municipalities that are very young, like Lucan, for example, has a lot of what you would call teens in the teen category, the young child category, that count towards their population, but don't count towards the number of electors. And their actual population is oversized compared to their electoral base, which is completely different. And you have a number of municipalities that are like that. And then you have some municipalities that are very closely matched because of their demographic to their electoral and population are very close.
Follow up, Curtis, are you good? Okay. Councillor DeVete, I saw your hand up.
I think I'm okay. I understand. Okay. Yeah, it was just clarification, nuances. And oh, the other thing was, I think, isn't nomination day sometime in the spring in the next election? It's not January 1st anymore.
Yeah, they've changed the electoral period.
Right, thank you.
Okay. All right, any other comments or questions? Okay, well, thank you for that discussion, and perhaps maybe the procedural bylaw is something to look at to see how maybe that can be a tool for us to use in the future. Okay, moving on to our presentation from Jessica, Human Resources, a look forward to 2021. Jessica.
Thank you, Warden. Chris, are you going to put the presentation up? Thank you. Good afternoon, everyone. This is a brief overview of the look forward for 2021. Chris, next slide, please. So our agenda for this update is our human resources team, our main HR projects for the rest of the year. I'm going to switch union negotiations first and then HR trends at the end. Next slide, please. So this is our human resources team. It's myself, the human resources manager. We have John Alston, our safety and standards officer. And we have a big question mark there for our human resources coordinator, which is the new position we're hiring for. We are actually doing interviews this week with the hopes to hire someone starting in the next 2 to 3 weeks. Next slide, Chris. And with that, with hiring our new HR coordinator comes one of our biggest projects is modernization. So we will be taking all of our employee files that are currently paper files and scanning them in and into Laserfish so we can have a modernization of our HR files so we can access them from wherever we are working because we have so many different service delivery areas. That's our biggest project. We're hoping to have that done, I would say, by August, depending on when the HR coordinator does start. The next big project is land ambulance, and we are transitioning to support land ambulance with HR. And again, with the HR coordinator, that's going to be both of us supporting that transition. And we're hoping to start that in August with a goal to be finalized by the end of the year. Hopefully before then, but as we know, things tend to pop up. And with the last HR project being local support, so starting to offer support to the lower tier municipalities where needed on various different HR services. Chris, next slide. So just an update on union negotiations. So earlier this year, we did ratify the collective agreement with QP 101.5. That was a 2-year term, so that is expiring the end of this year. So we will start negotiating with them again, maybe in December or January, depending on timing. ONA, which is the RNs at Strathmere Lodge, we negotiated, we went to conciliation twice, and we are now heading into arbitration scheduled for October of 2022. However, we may resume negotiations at some point in the fall just to see, can we come to an agreement before heading to arbitration, because it is a long ways from now before we can arbitrate that. Unifor 302, that's all the remaining employees at the lodge. We just ratified that last month. That is a 3-year term expiring December 31st of 2023. And last but not least is QP 2018, which is our outside workers. That collective agreement expires June 30th, 2021. We have received a notice to bargain. However, we have not scheduled any bargaining dates yet. However, I do believe that we'll probably start bargaining probably this summer or early fall. Chris, next. Thank you. So human resources trends. First one is competition for talent. We've received an overall decrease in applications. For example, our payroll and benefits position, which is a highly sought after job, normally we receive over 100 applications. We're significantly decreased down to approximately 30 applications. And we're seeing that that trend happening just due to global remote work. Everyone can kind of work wherever now. So we're seeing our candidate pool significantly decrease a little bit. And with that, we're still in the middle of COVID. So we do have the impacts from that where, you're not seeing as many people applying for jobs, whether that's because they are, having more work-life balance, or that could be because they're at home dealing with childcare responsibilities or family responsibilities. They cannot work. So, we're definitely just seeing an overall decrease in applications and, an increased competition for our talent as well. And second trend we're seeing right now, and we've all kind of discussed it, is the shift towards hybrid work models. And this, we've discussed this offers greater flexibility for our staff, which is, when we did the survey last summer, this is exactly what they were looking for. They wanted a hybrid model. Does require new management techniques, of course, because it's a different way to, manage our staff, different ways to, review productivity. There are, of course, some positives there for staff, cost savings. We have noticed for most of our staff an increased work productivity, and that gives them a lot more flexibility around their working hours. And with the shift to hybrid work models, kind of does go with our next trend right now is employee wellness and well-being. COVID-19 has impacted the employees' mental health, positively and negatively, of course. Focusing on the positives, of course, is the better work-life balance, the increased productivity, but the negative is definitely around mental health. And really, with shifting to the hybrid work models and staggering staff back into the workplace will really help our staff with the social isolation that they've, have been for the last year and a half. So really focusing this next half on our staff and their well-being. And this might be, having small staff get-togethers or offering different type of mental health workshops, because this is probably one of the biggest outcomes that we're seeing from COVID is a really big focus on employee wellness and well-being. And last slide, is there any questions?
Great. Well, thank you very much for that update, Jessica. Certainly appreciate it. Bill, I see your hand up. Is there something you wanted to add before I open it up for comment and discussion?
Oh, I did want to, just on Jessica's last slide, trends, we talked about some other ones we just couldn't fit onto the slides, and I just thought I'd throw them out there for council's edification. One is the use of our benefits, both from an EAP to traditional benefits, has changed dramatically. If Jessica and I looked at the chart of the types of benefits that were being used in 2019 versus today, we wouldn't even recognize it. And that goes from everything from, like I said, the EAP to dental costs. Quite a dramatic shift in that. That also, another trend we've noticed is sick time is way down, like off the charts down. So there's another trend we've noticed. Don't ask me to explain all this, but it is shocking just how different it is from 2019. Another thing that Jess and I are keeping an eye on is vacation storage. It's something, Warden, you and I talk about a lot, about the importance of taking your vacation, but we do see vacation storage. Everybody's doing it within the rules permitted in the agreements, but it's unusual to have this much vacation storage at this point in June. So that's another trend we're watching and trying to address. The other thing, some of you probably wonder why I was so anxious to get a lot of agreements done in, when Jessica first started in the role, I talked to her about how many we had coming up and let's get these done. Well, we're now seeing inflation levels in the States of over 5%. And when we started doing the negotiations, the inflation levels were at 0.4. So that's was an important reason to try and get some of these done, because the rising inflation that's happening in North America is going to have an effect on contracts and trends in settlements. And so I'm really pleased with that slide about how many we've negotiated long-term agreements now. I think that puts us in a solid financial position as an organization. The other thing that Jess and I are keeping really close tabs on is mandatory vaccination. This is something she can talk more about, but if you're interested, but we're following very closely the legal aspect of this. And, we have 36 different service areas. Mandatory vaccination may not be important in all of them, but in a couple of them, full vaccination is an important component. And we're watching how the legislation and the law evolves on this, including through the Ministry of Labor. So we can talk more about that. And then finally, the other trend I've been seeing is just how our tech support has changed. It is completely different. It was a very mobile, mileage-based service, going from office to office to office. It is, our mileage for tech support is way down. A lot of that has to do with some facilities being closed, but also employees are, in my view, employees are more willing to take on things that are minor tech issues now with tech support, which is different than before. It was hands off, just have someone come and do it. So those are 5 or 6 trends that I've been seeing along, and Jessica's been watching for us. But the world is completely different than 2019 from an HR perspective, and we'll see what the rest of this year is going to hold. Thank you, Warden.
Thank you for those comments. Any questions or comments for Jess on the report that she just presented? Councillor Vanderheyden.
Thank you for the report. Always interesting to read and figure out where we're headed and where we're coming from. And again, this is one of those fluid things that with employees, how many employees you have, with the age of your employees, the different jobs that we have. As you know, when I got on County Council, we really didn't talk about IT very much. Matter of fact, I remember the word connectivity coming onto the table, and that's how much of a dinosaur I am. And it was, we had the library take care of that because it seemed like a fit. We weren't really, it was interesting. At any rate, I think over the last year, and I heard Bill with all the different things you're talking about, the dental and the sick time, and because everybody's home and a lot of these places weren't open the first 6 or 7 months of the year, especially dental. I mean, you couldn't even go to a dentist till the second close piece was over. I don't even know what those phases were anymore, but anyway, till one particular phase. So I imagine, and this is just my assumption, is that those numbers will catch up because people will have to get all of that taken care of. And so I think those numbers will change. Sick time, it's one thing to be home and not feeling well. It's another thing to not feel well and then have to go to a job.
Mm-hmm.
That's a bit of a difference. I can be comfortable at home, finish a Zoom meeting in an hour, and then take a rest, where I can't do that at work. So I imagine those numbers will switch. The one that I really have some concern about is the vacation time, because people still need to take vacation. We can't have a vacation, everybody saving up 4 or 5 weeks of vacation and then figuring out what to do with that at the end. We won't have anybody working for half a year. Like that to me, whether that's in a contract or not, because of the extenuating circumstances of a pandemic, I think that's something that needs to be looked at very carefully and monitored. And I'm glad that you're doing that. So I guess it's more comment than a question, but those are some of the things that when you were talking, Bill and Jess, that I thought, well, that makes sense because we're in the middle of something very unusual here.
Yeah, and I think those are good comments, Warden, because we agree. We think that everywhere where something's low, it's about to go high. And it's not that we think this is I guess we used the term trend. I shouldn't have used that. It's more of an observation. because we don't think these are trends, the ones I mentioned about, you know, sick time, well, maybe sick time, you never know. Maybe we're going to wear masks more often, and maybe we're going to use hand sanitizer more often. Who knows? But I think all of these things are likely going to reverse themselves, and maybe to a magnitude where we have to be prepared for. That's the interesting part. So it's going to be an interesting 8 to 10 months as we readjust and see where the middle line falls.
I could just have a follow-up, Madam Warden, to the mental health piece. And I think when you talked about that is a very important piece that we really have to pay attention to as well. You know, even people that say they're doing fine aren't. There's a lot of things going on right now because of COVID. I gave council an example last night. My grandson was over on Sunday. He's going to be 4 shortly. And when he came in the house, he said, "Could I have a tour of your home?" I nearly fell over and started to cry. This is my grandson who's been at our house lots of times, but not in the last 15 months, not once, because of COVID. So he was little when he came to my house. That just about sent me over the edge, because I thought, seriously, my grandson doesn't recognize his grandmother's home. That's just a tiny little piece of what's going on in everybody's circles. And we need to make sure that our employees have all the help that they need, and that we even maybe reach out to them as opposed to waiting for them to reach out to us.
Well, we're very fortunate, Madam Warden, that you're the warden, I guess, because I can tell you there's not, and Jess will tell you as well, there's probably not one week that goes by where I don't hear similar things to what you just said, reminders from the warden about mental health. And Jessica and I take it very seriously. We talk about it at almost every one of our small group meetings. We check in often. Jessica's made some amazing accommodations within the building and workplace accommodations to help with those types of things. So it is something that I would say we're taking exponentially more seriously than ever before. And because of the times we're in, but also because of the people that are involved in making sure. So I'm really proud of the work we've done, and we can probably talk more about that sometime soon, but I appreciate what you're saying.
Councillor DeVete.
Oh gosh, I thought it was on mute. And it was, anyways, I'm already on. Thank you for the report, Jessica. It's interesting to hear the experience that you've noted, and I don't want to call them trends either, to Bill's point. I agree, people are working from home when they're not feeling well, as Councillor Van der Heijden said. The other thing is, because they're working from home, when the kids are sick, you don't have to run home to work from work to take care of those guys. So there's that additional piece too. The point I really wanted just to raise was, you alluded to this in terms of your number of applications for the positions that you're advertising for. That piece about talent attraction is coming up a lot in HR literature right now. But the other part of it, of course, is talent retention. And I think the comments that we've been talking about here in terms of holidays and making sure people are taking time off, and that they're like the hygiene factors at work are all working to retain those people. So I appreciate the update. It sounds like you're watching all of the sort of pistons that are firing, and hopefully we'll get good people in and keep all the good people we have. Thank you.
Thanks for those comments, Councillor DeVete. Any other questions for Jess? Any other comments?
Warden, just on Ina's comment about that, about retention, one of the things that Jessica's pointed out that I found interesting, and I'll tell you how we're addressing it, is that so many, Councillor Van der Heijden said this too, there's so many things have happened since COVID started that you're just not familiar with. For example, we have an IT department where we had 2 employees that had never even met other members of their team in person. And we've had births and babies and all these different things that have happened, and people just haven't had a chance to congregate and talk and socialize about that. So the way Jessica suggested we tackle that, and we've started this, is small groups. The warden and I hosted the IT group in very small groups to meet all the requirements this was it this week? Last week. It's still only Tuesday. Yeah, it wasn't this week. Last week we did that for our first group. And as the rules change and allow us even more, we're going to move on to other groups. But that was very interesting for the warden and I, because like I said, there was two people there and they were like in a team environment. They were shaking hands with other people or tapping or elbow bumping or whatever the heck you do these days and saying, oh, hi, I am. And they've never met each other. And one of the things that Jess has been pointed out to me a lot is if we're going to keep people, for many people being part of a smaller team, not the global Middlesex County team, but that IT team, rah, that planning team, rah, that's going to be very, very important in retaining and attracting people. So we, like Chris Bailey and I talked about little things we can do to get that team bonded even more than they are. And we're doing that with a lot of the departments that are of that size. And we're going to keep working our way through that over the coming months. But it's a brilliant observation, I think. And I just wanted you to know some of the small things that the warden and Jessica and I are doing to try and tackle that challenge, to try and keep that talent in place. Because if the emails we've received since we started doing that are any indication, that was probably some of the best work we've done in talent retention this year. So it was pretty exciting to see the result.
Sure. For sure. Okay. Last call for comments or questions on this report. Okay, then we are ready to move into our action items. And the first one up has to do with insurance for our renewal for this year. And it is a report from Cindy and Chris. So not sure who's going to run with it. I see Cindy's unmuted, so I'm sure she is. And just so everybody knows, Tony Camiso has also joined us in the event that we've got some questions and need some expertise from him. So Cindy and Chris, I think.
So thanks. Through the warden to council, attached is the 2021 insurance renewal. The renewal is for a 12-month term, consistent with last year. The program reflects total premiums of $957,986. So this is a 22% increase over the last renewal. I just would like to point out that this increase is consistent with increases by other municipalities in 2020 and 2021 renewals. Increases have ranged anywhere from 20 to 23% on average. So at this time, I'm going to recommend that the insurance program be approved. And as the wardens pointed out, Tony from Intact is here to answer any questions, along with Chris Trainey and myself. Thanks.
Okay, thanks, Cindy. Comments, questions, clarifications from any members of council on this? Councillor Brennan.
Yeah, I'm just wondering, either through Cindy or the insurance agent, what is the major driving force for a 22% increase? Is it strictly because of the mental health issues, or what exactly is driving that sort of an increase?
Okay, thanks, Councillor Brennan. Not sure who wants to take that. Tony, did you want to take that question? And welcome.
Hello.
Great to see you.
Hello. Thank you, Madam Warden. Hi, everyone. Great to see everyone. Yes, lots to talk about here when it comes to the county's insurance, but what is the primary driver for the increases this year? It's really two things. Number one would be the current market conditions. We started seeing some significant rate increases happen around the end of 2019. All of 2020, we saw similar double-digit increases across the province and into other provinces. More specifically, if I had to nail down to one particular reason why the rates are going up, it's the cost of insurance claims, and not the fact that there's more insurance claims than in historical figures, but the cost to investigate and adjust and settle insurance claims. That's what's really driving the current increase in insurance premiums. That's a very high level overview. I want to keep that as concise as I can.
Thanks, Tony. Do you have any follow-up, John?
No, thank you.
Councillor Richards.
Thank you, Madam Mayor. Maybe just send this one to Tony. The cyber attacks that you've all heard about, stuff like that, how is the county positioned to protect themselves? And is that part of the increase as well?
Thank you, Counselor. A good question. Cyber insurance is the hottest issue right now when it comes to municipal insurance. It is something that is evolving daily. And when I say that, I mean, it seems every week or every day we get a new email on some type of new scam or new type of way for public entities to be threatened by these threat actors. I can tell you personally, I've had to deal with a few municipal cyber claims already. And it's a trend that 5 years ago, we started mentioning it, and now it's at the forefront. And I think the county is positioned very well. You guys have had cyber insurance. You have a specific cyber insurance policy in place for over 2 years now. So in terms of potentially offsetting some of the cost, if there was a cyber event, you guys are protected, but it's evolving daily. And actually our webinar that we have coming up, I think it's at the end of the month, actually maybe even this week, I think it's Thursday if I'm mistaken, is about cyber insurance and social engineering type claims. So if members of council haven't already signed up, please do. I think it's something that hits home for every municipality, regardless of your size. Because again, like you said, there's been so many ransomware attacks, specifically attacking municipalities, even before 2021, but into 2020 was a record year where we had $1 million type losses in terms of cyber, where typically that policy cost very insignificant compared to your like municipal liability policy, which is much higher in terms of the bulk of premium that you pay on an annual basis. So a very, very scary trend happening in public entities, cyber insurance. But to answer your question, sorry, yeah, the county is very well positioned.
Thanks for that, Tony. Councillor Vanderheyden.
Thank you, through the warden. Good to see you, Tony. I had a couple of questions. One to the whole process of insurance, which we all have to have, and we have no way of not having insurance, because that would just be that we couldn't even talk about that. But the sustainability for municipalities, I mean, 22% a year, it just becomes to the point of, well, we just tack it on every year because it's a market trend. Well, I think I know you do have some, it's about how many claims you have, and there's a whole formula, I know, and I don't know that whole formula, but that's what we use. But it just gets to the point of, at what point do we ever, I've never really hardly seen it go down. I know we've had a couple, but not very many over the years that I've been at this. But it just seems it's almost to the point of, like, then you get the cyber on top of it, and then you get this, and then you do a deductible, and then you increase the deductibles so that we, try to play with the numbers. And it just seems to be a real game, and it's very stressing for me when I read these reports. In this report, it talks about exclusion of liability for long-term care, and that's on page 2, I guess, under the analysis. What does that actually mean? Like, are we now changing the liability level for long-term care because of COVID, because of what all happened there?
Great question, Councillor. It's actually the biggest change on the program. This is something that was applied to every municipal risk across Canada, and it's specifically because of COVID. We had to add an exclusion related to COVID losses, and it's simply because, well, not just us, but every liability insurer for every long-term care facility was inundated with class action lawsuits related to COVID. So the companies added an exclusion to try and offset some of those losses. Obviously, since that's been incorporated, the province here in Ontario has added some legislation to help offset potential class action claims against municipalities or other entities that provide long-term care. I don't want to get into the details of that bill specifically, but there is some protection there. But again, it only applies to that specific facility and not the entire corporation. And I hope I bolded that enough within the report, but perhaps I didn't. And to answer your other comment about the sustainability about the insurance program, the insurance market is very cynical. I believe we are in year 2 of potentially 3 or 4 years where you're going to see these significant adjustments. I hope it's done sooner. I hope 2022 is much more stable, because for a very long time, even since when I started with Frank Cowan Company, which is now Intact Public Entities, it was always single digit. The adjustments were always single digit. They were always manageable. They were always managed to be budgeted. But now you're right. We're in the second year now where we get these big rate increases. And you're right. When is it enough? And historically speaking, it takes 4 years for the market to correct itself. The insurance industry has had 4 similar type events since the 70s. So it seems to happen every 10 years. For some reason, the 2000s, it's been a long time since we've had double-digit rate increases overall in the insurance industry. So it's one of those things where I hope it's over. I hope it's almost done, but we could be in for it for another 6 months or another year. I just don't know for certain.
I could have a follow-up, Madam Warden. Just to those points, you know, we've seen things along the lines with joint and several liability, now COVID. There are accidents that happen and people are getting more litigious. And I just want to stay as politically correct as I can be and not put my opinion in here, but sometimes things just happen. Sometimes things are beyond our control and beyond our ability to change. And COVID is one of those. When a person has an accident, that's one of those, but it always seems like they're trying to find the common denominator so they can be litigious and get paid out for things that are just really crappy. So is this something where we need to start thinking about what we can do with the courts or what we can do with legislation in order to say, you know, you fell off your bike, you broke your leg, get it fixed. Don't sue the community because, well, I just happen to fortunately do it on a sidewalk that belongs to municipality. And that's about as politically correct as I can go without going over the edge.
I don't know whether you want to jump on that, but I think that Councillor Vanderheyden, you made your point, and I think we would all agree with what you said. So we'll just leave it at that for now. Any other questions or comments from council? Councillor DeVete.
Thank you, Madam Warden. Tony, I just wondered, I'm glad that you're optimistic about the cycles and that you are hoping or foreseeing that there might be some sort of calming of the rate increases that we're seeing. I'm hearing disturbing things, though, other things that are popping up. For example, the one that jumps out at me right now is the homes that are in sort of the Oakville, along the Lake Ontario shoreline. There's a huge amount of conversation going on down there with the conservation authorities, municipalities that issued building permits in areas that are now experiencing flooding, and municipalities are being hammered on that. So I guess it's just a comment. I'm not sure there isn't another sort of Loch Ness monster with his head over the horizon on the next cycle. So maybe just being doom and gloom, but between joint and several, and as Councillor Vanderheyden has pointed out, all the other stuff that's going on, and hearing at AMO about the municipalities that can't even get insurance for certain, I'm thinking towards the Windsor-Tecumseh area, that can't even get insurance for certain parts of their business as municipalities. I'm glad you're optimistic, because that means I'm probably not reading enough about it. So thanks for your presentation.
Thank you for those comments, Ina. Any other questions, discussion at this point? Okay, seeing none, you do have a recommendation in front of you that the proposed 2021-2022 insurance program as submitted by Intact Public Entities with a premium of $957,986 for 12 months, plus applicable taxes to June 30th, 2022 be approved. Can I get a mover and a seconder for that, please? Councillor Ropp and Councillor Warwick. All opposed? And that's carried. Thank you very much. Thanks very much, Tony, for joining us. It was great seeing you, and hopefully in the next couple months, we'll be able to see you in person somewhere.
Agreed. Thank you so much, everyone. Thank you, Madam Warden.
Yeah.
Take care, everyone.
Take care. Okay, Cindy is going to be reporting and presenting to us the Community Safety and Wellbeing Plan.
Great, another report. So I'm back again. Now I'm going to talk about the Community Safety and Wellbeing Plan. So through the warden, the municipalities in Middlesex County have worked together to develop a shared community safety and wellbeing plan for Middlesex. This is a shared plan, but it also does reflect the uniqueness of each local municipality. The plan was created in response to legislation through the Police Services Act. The deadline for the plan is July 1st, 2021. The county's role was to coordinate the collaborative approach, and the county hired Jennifer Kirkham to organize, engage, and develop a community safety and wellbeing plan on behalf of the county and local municipalities. A project steering committee was established to guide the process, and it included the CAOs from each lower tier, county senior management, and 2 county councillors. An advisory committee was also established to review the data and identify potential areas of focus, goals, and objectives of the plan. This advisory committee was comprised of 23 members that represented over 17 different sectors. This plan is a 5-year plan that goes from 2021 to 2026. The priority areas identified in the plan is health, housing and homelessness, quality of life, and public safety. There is no provincial funding to support the plan, so implementation will really require the community, local municipalities, and the county working together. The Community Safety and Wellbeing Plan has to be approved by County Council and also by each local municipality. I know that Jennifer Kirkham has already attended a few council meetings. I think she's been to Lucan-Badolph and North Middlesex to discuss the plan. At this time, I'm recommending that the county approve the plan and a copy be forwarded to the Ministry of the Solicitor General. Thanks, and I'm happy to answer any questions. However, I'd also like to say a big thank you to the Economic Development Department for pulling together the layout and design of the plan. I think it looks great.
Great. Well, thank you so much, Cindy. And yeah, it is a very good looking document. No question there. So team effort. Questions or comments on the Community Safety and Wellbeing Plan as presented? Councillor Vanderheyden.
Thank you. Through the warden, we put this on our council agenda last night and it went very well. Everybody accepted it. So just so you know, I just want to kind of highlight page 17, 16, where we're talking about housing. And this was pointed out at our council meeting last night too. When you look at the numbers, they're actually frightening. You know, housing affordability is a top problem for renters. We can't find any place for people to rent. The prices are going up. A number of landlords are saying, okay, we're going to sell this place now, so you're out on the street, and they can't find anything else. And the reason they're selling them is because they can make money on their investment, which I get. But that being said, when almost 35% of renters with shelter costs totaling 30% or more of their income, 30% of your income on housing or more. And with the housing numbers going up, rent going up, cost of housing itself, if you buy a house, it's gone up. And then you have 12% of homeowners are also have unaffordable housing. This is a huge problem in across the country. And when we see these kinds of numbers just in our own communities, and of course, there's no funding attached to any of this. How do we, you know, you're going to have a report later, Cindy, on housing. These numbers are frightening. I don't know how we get past this and how we move forward and how we convince the public that this is real, that we have a housing problem in our communities. And, you know, we're going to be seeing homelessness creeping up even more, and that's not acceptable in our community. So we really have to work hard on this, especially this piece.
Yeah, I think you summed that up, Joanne. I think that is going to be the biggest challenge for municipal governments in the coming years, no question. Any more comments or questions? Councillor Mayhew.
Thank you, Madam Warden, very much. Cindy, an excellent report. Enjoyed that. I remember quite precisely the day that Dr. Chris Mackey spoke to County Council. And in that dialogue, he presented the health of our residents in Middlesex County was on a lower scale than it was in the larger urban areas. And there was more cardiovascular problems, there were respiratory problems, and cancer came into it as well. And we were all somewhat surprised with that, I think, on the initial viewing of that, because the county, with its beauty and its more relaxed lifestyle, you think that the opposite would be true. But when you look at the numbers, our residents of Middlesex County do not have as good a health conditions as the people in the large metropolitan and urban areas. And so we asked him at that point for a reason behind that, why? And the answers weren't given at that time, but there was supposed to be some focus on getting to the bottom of it to find out what the reason is. But I certainly hope that we're aware that I think one of our responsibilities should be to monitor in a comparison element the health of our people compared with the health of, let's say, hypothetically, the City of London. And right now we are on a lower scale than them, according to the Middlesex London Health Unit statistics. And as a councillor from my municipality, I walked away extremely concerned about that.
Thank you for those comments, Councillor Mayhew. I think everybody will remember that Dr. Mackey was here days before the states of emergency were declared for the pandemic. And I think it's going on maybe 2 months now, 2 or 3 months, when Councillor Elliott did bring forth the motion to follow up with the health unit and ask Dr. Mackey to come back. At this time, nothing has been scheduled. He did communicate back with Kathy that he had received the request and that they were aware of our concern. But at this point, because of the work that they're doing with the pandemic, they're unable to focus on that concern. But certainly, I think maybe after the summer, certainly if the numbers stay the way they are, we can reconnect and ask him to come back. Again, remind him of that request. Any other comments or questions? Councillor DeVitt.
Thank you. It was just more of an observation, and it's probably heightened response, I guess is the way to put it. When I look at the categories that we talk about, social development and prevention, the bullseye that is on page 10, I guess it is. And as I read through the report, when we talk about sort of social and demographic and those kinds of variables, things like poverty and things like that, and then we talk about prevention and victimization or harm. The part that was missing for me in this report was the part that addresses diversity and inclusion and those kinds of programs that result in, well, even in our community, we have incidents of, how do I put it politely? Cases where we have victimization or harm happening to people because of variables that are visible to the members of the community. So I don't think we have to list everything maybe in every report, but given the sort of spotlight on issues of inclusion and diversity, making sure that residents and community members are safe and have opportunities to recreate and live safely and develop as good residents and citizens and take benefit from what we offer. I thought that might be something that we might, at least in programming, focus on in going forward and implementing this kind of a community safety plan. So it's more of a comment. That was it.
Thank you for that. Any other points of discussion? Okay, so you have a recommended motion in front of you to approve the plan and forward it to the Ministry of Solicitor General as required. Can I get a mover and a seconder for that, please? Councillor Cornelison and Councillor Elliott. All opposed? And that's carried. Thank you. Okay, Chris, 5-year machinery replacement program.
Yeah, thank you, Madam Warden. And this is our annual report on machinery. We're getting a little bit earlier in the year because we're having some challenges, especially with supply. I think anyone who is had any recent experience in the construction industry understands how difficult it is to get supplies, especially things from across the border. So we've had a very challenging time getting our trucks constructed, fabricated, and delivered in time for us to have them ready for the following winter season. So more critical than ever to have these pieces of equipment. You can see there's several in this 5-year guide that are due for replacement next year. Have those tendered early as we can in the process. So as per our past practice, we've been budgeting for equipment replacement in the following budget year within the current budget year. So this is our 2022 equipment replacement. Many of these pieces of equipment we won't see until the beginning of the winter next year. But it's based on a sound asset management policy or practice, which is that we try to replace our equipment at a point where we are still able to rely on that piece of equipment for the year it's still in service, and also have sort of a very minor sort of residual value at the end. So we don't want to be chasing equipment, dealing with breakdowns at the side of the road and then putting ourselves at risk to not meet our obligations under the minimum maintenance standards regulations for winter maintenance, especially. But you'll see that we have a 5-year capital expenditure of 4.15 million. We've been running with that level of capital expenditure. It's about $830,000 a year, but we keep that level over a 5-year guide. And again, it allows us to replace all the equipment in our fleet at the time when it sort of at the end of its useful service life, and then have a little bit of a buffer so that we have some money in our reserves so that we do have a catastrophic failure of a piece of equipment. We don't impact the current year's budget in order for us to get a replacement in short order. We can draw from reserves in order to put that piece of equipment back into service relatively quickly. So you'll see there's been a slight revision in the 5-year guide. Again, it's slightly higher this time around at 4.122 million. It was 4.017 million. That's for a couple of different reasons. There's some inflationary things in the 5-year guide, and then just some changes of where things are within that 5-year guide. Things will fall off and new things will come on. We have a couple of very high value pieces of equipment this year, 2 snow plows and then a few pickup trucks. We have been continuing to have success with tendering our pickup trucks in the fall for delivery in the early part of the following year. Again, not as great as it's been in the past. We're still dealing with that. COVID hasn't helped us. Again, the dealerships will tell you they're having some trouble at times with supply, especially with pickup trucks, the most popular type of vehicle out there nowadays. So we do have some challenges with that. We are still receiving fairly good pricing on those pieces of equipment. And then again, the number one issue for us is, in this guide, you'll see we have a triaxle and a tandem snow plows that are due for replacement. If we don't tender those late summer, early fall, we won't see them in time for winter the following, November 2022, which seems a bit crazy, but it is taking us that long to get those pieces of equipment delivered and commissioned for use in our fleet. So I'll leave it at that, Madam Warden. If there's any questions, I'd be happy to answer them.
Thank you for that, Chris. So any questions from Chris's report? Councillor Ropp.
Thank you. Chris, I'm in favor of the report. Just on the report, I was thinking of watching one piece of equipment here in particular, and that's that vac truck that we have. Do you see that, is it performing well, and do you see that lasting a full cycle of term cycle, or you think that will have to be replaced a little earlier?
Well, through the word to Councillor Robb, it's one we watch because it runs all the time. We wear out the tires on that thing because it's rolling all year. As long as the ground is soft enough for us to use, we're using it to clean out catch basins. We're vac-exing around bridges. We're locating infrastructure. So it runs constantly. It's brand new. Basically, we got a new one a couple of years back. So it's in really good shape. And the one we had previously, we bought used just to see if it was a valuable addition to the fleet, and it has been. So it was one we'll watch. It's far enough out. We haven't had any problems with it as of yet. But again, as you note, it's that and our paint striper are probably the two most valuable pieces of equipment in our fleet. And we watch them very carefully, and they're very well maintained, as is all of our equipment. So it's a good point. It's a fair ways out, but we're pretty confident in that replacement schedule.
Thank you.
Any other questions for Chris on his report? Okay, so the recommendation is in front of you, and I would ask for a mover and a seconder for that, please. Councillor Ropp and Councillor Mayhew. All opposed? That's carried. Thank you very much. And we're back to Cindy. Cindy's had a big afternoon with reports. This one's homelessness prevention and housing plan for Middlesex County, an update, and then listing our priorities for the upcoming year.
Great, thanks very much. And thanks, and through the warden. This report provides an update on the Change Begins with Choice homeless prevention and housing plan for Middlesex. The City of London is a provincially designated service manager as it relates to housing for London and Middlesex. However, the county, through a contract with London, delivers the homelessness portfolio. The plan that was approved by council identified that the most pressing housing issues in Middlesex are lack of affordable housing, lack of rental housing, lack of emergency housing, and lack of income. And I don't believe any of this has changed since it was approved. The vision is that the vision of the plan is that every Middlesex County resident has opportunity to access the type of housing they need in their community. Appendix A includes a homeless prevention update that ties directly back to the council approved plan. Appendix A will be provided to the City of London to be added to the service manager's report that goes to the Ministry of Municipal Affairs and Housing. And this report is due by June 30th. At the May 11th council meeting, an update was provided for CHIPPY and Social Service Relief Funding, SSRF, which really is the funding for our homelessness programs. An overview of this information has been included in this report. So some of the 2020 highlights, I'm not going to go through all of them that are listed in the report, but so we had the success of the new Community Navigator pilot position, which is operating through our library system. The creation of the Social Services Committee Partner Network, the Provincial Social Services Relief Funding, SSRF. We had phase 1 and 2, and of course, phase 3 is in 2021. We also had the Canada-Ontario Housing Benefit, and we had 6 residents that was able to take benefit of this program. We had the annual housing update that came to council from the City of London, and that happened in October of 2020. We'll also have to arrange for that for 2021. And in 2021, county seat on the board of directors for London and Middlesex Community Housing. So we've seen that at the last council meeting. So some of the priorities for 2021. So we have, again, the SSRF phase 3. So we're currently putting those programs out right now. They go till December of 2021. We need to continue to advocate to the province for additional funding to support the homeless and housing initiatives. We need to advocate for program investments like the COB as they improve housing stability for low-income households. We need to connect with CMHC, and actually Dirk and I have already reached out and had one meeting to obtain Middlesex housing data so we can really better understand the housing market and what we need in our communities. Everything really is focused on the large urban areas, so it's hard to get that housing data for Middlesex County. And drilling it down, we do have some good information for Strathmere Caradoc, but for some of the other communities, we don't have a lot of data. Also in 2021, the Economic Development and Planning Department are going to work with the local municipalities to facilitate housing opportunities. And if you have some questions, you might be able to ask Dirk and Kara that later. And we're going to continue to work with the City of London on advancing social and affordable housing initiatives in the county. So at this time, I'm recommending that Appendix A be approved and sent to the City of London as a service manager. The link to the London's 2020 Council Housing Update is in the report, and I believe it was also attached to the last council meeting. Of course, again, I point out that the City of London is the designated housing for the province, so it is important to look at that report and try to tie in how they're supporting the county as well as the City of London. I also want to say a thanks to Pauline Andrew and Joe Windsor for their work on these initiatives for homelessness. And I'd also open it up to answer any questions.
Thank you, Cindy. Comments, questions on what has just been presented? Councillor Vanderheyden.
Thank you through the ward, and thank you for the report. And we need to put this in place in order to really get to the next stage where we actually get more work on the ground. And I'm not saying that we're not doing work on the ground. I'm saying we need to do more work on the ground. These numbers keep increasing. We really have to figure out some plans on how to get to that next level where the people that are the most vulnerable right now get supports. And it's, when I read the first set of 5 at the very beginning of the report, sorry, I'm just screening back to that, lack of affordable housing, lack of rental housing, and then long wait list for mental health and addiction support services. Well, that's really a health issue. That's really something that belongs in another category. And yet we all see how that is now twinning and feathering in with all these other things that are happening, and how lack of emergency housing, which I have to say thank you to the community for all the help that they've done with the emergency housing throughout COVID. Lack of income, how do we get more places for people to work so they actually can get out there and get the funds they require in order to get to the rental housing that we don't have. So it's so tied together that it's important that we put this in place. And then, you look at the Chippy funding, $120,000 for a county the size of ours with almost 75,000 people, $120,000. Seriously? Are we just supposed to sit on this and say, thank you very much? I don't think so. I think we need to really start banging on some doors here and saying, this is not acceptable. Rural Ontario, small urban and rural, need help here. And we don't want to just be a tag on to a line in a big city budget to say, well, we're going to give them 120 this year. They should be happy with that. Maybe we'll give them 130 next year. I'm sorry I'm being so negative, but we need to start doing something to move our communities forward. And this is one of those places where when we have vulnerable populations, they need help right now. Again, another comment, not really a question, sorry, but I'm just so, I'm to the point of where I'm always afraid I'm going to say something politically incorrect because it's so frustrating that we aren't moving further faster.
Thank you for those comments, Councillor Vanderheyden. Councillor Mayhew.
Thank you very much, Madam Warden. Yes, I too share some of Joanne's sentiments there. We have a very talented staff, and Cindy, it's a great report, and I know that is the bullet in your belt when you go to negotiate with the city in terms of the allocation of funds, but it's very nice to see a policy document turned into a project. And that is, I think, the ultimate test of governance is when we can actually touch and feel something that we have created policy for. That being said, the availability of land seems to be a real problem on this housing in some of our areas. And I know, Cindy, it is in my municipality. And I'm wondering if others share that. Many of us have experienced an increase in the development opportunities in terms of residential housing. And that has reduced our inventories of land, and particularly for geared to income housing or affordable housing. And Cindy, the availability of land, is that taken into perspective as being part of the problem? Thank you, Madam Warden.
Thanks, Councillor Mayhew. Cindy?
To the warden, to the counselor, definitely that would be. I'm not sure if Dirk, you want to comment on that? You probably have a little bit more perspective than me.
Certainly through the warden. It is that complex issue, of course, and as our municipalities are experiencing more growth, and inventory is used, if you want to call it that, and so we have to make sure that we have enough supply or lands that are designated, serviced, which of course is a local municipal responsibility, and then there's the private sector component, primarily of developers coming forward. So we don't want to unduly constrain growth within our communities, and then on the flip side of that, of course, is the provincial and other planning policies that do require the protection of agricultural land and the development to occur on full municipal services in a phased and appropriate manner. So there are those competing interests on that, certainly.
Any other questions or comments? I might jump in on just jumping off of Councillor Vanderheyden's comments, because as Councillor Mayhew said, I think we can all agree with the frustration and that you voiced, but we are meeting with our local MPs on July 2nd, and the funding concerns will be brought up at that point again with them. I know the Women's Caucus has brought it up in another area of social services, but we do have CHIPPY funding and the funding model on the agenda for discussion. Okay, if there aren't any other questions or comments, then you've got the recommendation in front of you. A mover and a seconder for that, please. Councillor DeVitt and Councillor Elliott. And all opposed? And that's carried. Thank you very much. Thank you for your work on that, Cindy. Okay, correspondence and information items. Strathmere Lodge Occupancy and Activity Report for May 2021. Of course, this is a report from Brent. AMO update June 3rd, 2021. AMO update June 7th, 2021. AMO update June 10th, 2021. Middlesex London Health Unit Board of Health meeting update for May 20th, 2021. And a letter to Premier Ford from Warden Burkhart Jessen re MLPS vaccination program. Bill, did you want to speak to this? And it appeared, oh, there he goes.
I just was sliding. I've got a very big desk here at MLPS. I was just sliding back and forth. So the vaccination program is going very, very well. We have just today, I got another update this morning on how well it's going. I want to point out, and I think the warden would want to too, the important work that Miranda Bothwell is doing on this project. She has really stepped up and taken this project to heart. And what as you know, what we're focused on is large employers, just-in-time delivery employers. And we're also focused on our community paramedicine clients that have trouble throughout the region and getting to vaccination clinics. So we are keeping very close tabs on two things. One is the number of vaccines, and we have asked that we get more vaccines because the program's been very successful. Lots of people interested in the program. So the warden's asked 2 different ways for more vaccines, and I've asked administratively for more vaccines, and I think we will get those in time for the program to keep going next week. But we'll keep you up to date on that. The other thing we're keeping very close track of is just how well this program is working from an efficiency and effectiveness point of view. Just incredible work by our group to design the program. So, for example, tomorrow's Cargill. Wait, today's Tuesday. Thursday and Friday are Cargill, and that's 500 vaccinations that'll be done there. The drive-through model is very efficient. We're doing twice the vaccinations with half the people in half the time. So that is a real improvement in terms of efficiency of getting people vaccinated. And we're keeping track of that because that may be useful in the future as a model for how we do flu vaccines or any other future COVID vaccinations that we may have to do. So it's a bit of a case study that we're trying to keep track of and working with the Premier's Office and the Ministry of Health on making sure they're right up to date. But we really feel like this program needs to keep continuing, and we're focused on a few other large employers, but we're also now moving towards doing pop-up clinics in some municipalities, some local municipalities. So we're preparing for that. But the team has, much like other organizations, we've kind of thrown a lot of resources at this particular program in an effort to get us across the finish line with full vaccination. And one of the things that we're also preparing for is second dose clinics, because every large employer we've been to has said, can you come back for a second dose clinic? And so we're preparing the ministry for that. You can imagine, in talking directly to CEOs and presidents of these companies, the productivity enhancement from not having to lose an employee on a just-in-time assembly line or manufacturing plant for 4 hours or more is pretty amazing in terms of productivity and efficiency for Southwestern Ontario. So I know everybody at the province is pretty pleased with how it's going. I know the warden's extremely pleased, and so am I. And we'll continue to keep giving you updates as we go along, including I'm hopeful that we'll be able to, we're not able to show you individual pictures, but generally I'd like to show you just how the drive-through works at Cargill. And we're going to work, the warden and I will be up very early on Thursday, trying to get you some more information about just how this works. But the feedback has been awesome. So thank you for your support of this kind of unusual and unique program in Ontario. And thank you, Warden, for your help in getting us the vaccines.
Thank you for that update, Bill. Any questions on that for Bill? Well, okay. FCHS Foundation Spring 2021 newsletter. Budget variance report from Cindy. I don't know whether you had any comment, Cindy. I think it's all there, but is there anything you wanted to add?
Sure, if you want, through the warden. This is the first budget variance report for 2021. The variance is for the period January to May 2021. The expenditures to date are within budget and a little lower than budget. As a result of COVID-19, there are some savings due to lower travel costs, virtual conferences being held, and alternate delivery service models, such as we're seeing early on in our libraries. Consistent with 2020, some departments, such as long-term care and land ambulance, have received additional funding from the province to offset these additional costs due to COVID. In 2020 and 2021, the county has received COVID-19 funding from the province. We're very grateful for that. In 2020, the county utilized approximately $868,000 to offset lost revenue and additional expenditures. And at the next council meeting, July 13th, we'll be coming back with their financial statements, and KPMG will come with the audit report. The remainder of the 2020 allocations can be used for 2021, and we've set those aside. Finance has to report back to the province by the end of June 2020 with an interim report on 2020 expenditures and the plans for 2021. We also have to submit our budget for 2021. The final report to the province is due in spring of 2022. And I'm happy to answer any questions.
Thank you, Cindy. Any questions for Cindy on this? Okay, seeing none, then I would ask for a mover and a seconder to receive those items for information. Councillor Richards and a seconder. Councillor Cornelison. And all opposed? And that's carried. We were to go into closed session, but staff has asked that we defer that until the next meeting. So if I could just have a mover and a seconder to defer that session to the next meeting. Councillor Warwick, and a seconder, please. Councillor Smith. All opposed? That's carried. Thank you. Any inquiries? So at this time, I'm going to, as soon as she looks up, turn the microphone over to Kathy.
Thank you, Warden. I just have a few comments. It has been a privilege to work for the County of Middlesex for the past 31 years. I have thoroughly enjoyed my time here working with all the wardens, the members of council and staff over the years. It would take me too long to name everyone from my employment, starting with Warden Al Johnson in 1990 and ending with yourself. A big thank you to Ron Eddy, who hired me, Nigel Belchamber, and the past 23 years working with Bill. I will stay in touch with my Middlesex family and hope to see you all in person sometime in the near future. I want to welcome Marcy to the position. She's going to enjoy it and thrive. I'm sending virtual hugs to everyone and all my best wishes. Thank you. Thank you.
I have my Kleenex. Thank you, Kathy. As I said earlier, there will be a time in the future when we can all get together, but you will be missed. Your mark has been made across the county, and we really do thank you for your commitment and your love of Middlesex County. And best of luck and congratulations, and enjoy your gift to you. You will get a lot of use out of it. Our next council meeting is Tuesday, July the 13th, and if all goes according, we all received an email from staff last week or yesterday. We should be able to do a hybrid in-person meeting, which I think we are all excited about, and we'll be anxious to see each other then. The Warden's Golf Tournament is still scheduled for September the 16th. And with that, I would ask for a motion to adjourn at 7 minutes after 3. Mover and a seconder, please. Councillor Smith and Councillor Mayhew. All opposed? That's carried. Thank you very much.